with Dr. Raouf Hanna and Marlo Blue.
Laura, thank you. Welcome back to Open Journal. I am here in the studio with Dr. Raouf Hanna. Dr. Hanna, thank you for joining us today. And we are here to answer your questions at 713-526-5738. Again, that number is 713-526-5738. So, Dr. Hanna, you've been doing this for a long time. Are you enjoying working with students as well as clients?
Yeah, actually, I'm very, blessed to be working and doing what I like. I couldn't find what I like more, so I decided to do both.
Well, that's perfectly understandable. What question do you get asked the most, would you say?
Well, surprisingly, I get sometimes, or the most questions I get sometimes have nothing to do with the procedure itself. Sometimes I get if a question that I get is like if I go through security at airports, where will the implant beep? And it's a good question because, actually, no. I've actually went back and asked patients if they ever had problems. And I guess the mass of the titanium in the jaw is so small that it's undetectable.
Yeah, I have to add, that's probably would have been my first question. Let's go to the phones today. At first, we have Melissa on the line. Melissa, you're on the air.
Hi. My question is, what is the biggest issue that patients face or fear in recovery from the procedure?
Okay, well, it's a very common question is how am I going to feel after the procedure? And surprisingly, I've seen that reaction over and over in the follow-up appointment that patients told me that it was painless, there was no discomfort, and that they did not need to take any or little pain medications.
When you do mean pain medications, do you mean just like ibuprofen or? We
actually give 3 medications are commonly prescribed. One is an antibiotic to prevent infection, and one is an anti-inflammatory like any of the ibuprofen or family, and that's to prevent swelling and also has a little pain control. And we sometimes give a stronger painkillers just in case they're needed.
Right. Let's go back to the phones again. Thank you for that call, Melissa. Let's go to the phones for Kelly. Kelly, you're live on the air. Do you have a question for Dr. Hanna?
Yes, I am a big baby. I am terrified of the dentist's office. I haven't been in 8 years. I probably should go, but pain, even the fear of having my mouth clean scares me. And he mentioned some things about sedation. I was just curious about how it all works.
Yeah, well, it's another common question, and I will tell you that we have several ways of treating the anxious patient. For moderate anxiety, we have either laughing gas or oral sedation, which are pills kind of like the Valium family that you take an hour or so before the appointment, and it will make you more calm and more relaxed. Those are also dosed to effect. You'll be monitored all the time through blood pressure and oxygen, blood flow, and all that. You have to have a certification actually to offer this kind of sedation. And for the severely anxious patient, we have IV sedation options, and they're done by also a specialized anesthesiologist that just do that in the office, and we put you completely to sleep, so you're not there.
Thank you for that call, Kelly. Any other questions? Oops, gone. Let's go back to another question with Harvey on line 3. Harvey, do you have a question for Dr. Hanna?
Oh, yes, I do. I was actually wondering how the implant surgery that you're talking about is possible in one visit. I was, wanting to know about the reduced healing time. So I guess basically what I'm asking is, how is it sped up?
Okay, well, the implant process is done in one visit through advances in technology and advances in the surface treatment of the implant itself, plus newer or more advanced surgical techniques and implant designs. So now it is possible, actually, it is very common in our office to place the implant as the same day and also attach a temporary to it. So it's becoming the norm. And the exception is when we place the implant and tell you that you'll have to wait for 6 to 12 weeks to get the final inserted. So that's how we can now offer immediate placement or immediate placement and immediate restoration with at least a temporary provisional crown.
Thank you, Harvey. Any other question?
Oh, no, that was all.
Thank you, Harvey. Again, you can phone in your questions on dental implants to Dr. Hanna right here in the station. It's 713-526-5738. We are Open Journal, and this is the call-in portion for Dr. Raouf Hanna. Let's go to the phones again for John in the Heights. John, do you have a question for Dr. Hanna?
Yes, hi, Dr. Hanna. I was calling to see, you mentioned that you teach at the university. Do you do pro bono work there or through your office? And if so, how would a patient like myself get in touch with you to do so?
Okay, well, yes, we do, and I would love to do more. There is there's several ways. You can either call the office, and sometimes we will do it in the office or through our partners and local charities as Grace Foundation or Bering Omega Community Services. If not, there is also through the school. It's not free at the school, but it's at very reduced rates for teaching institutions. And there is also other community facilities that we work with and can refer you to.
Thank you, John. Let's move on to Michael in Houston. Michael, do you have a question for Dr. Hanna?
Yes. My teeth have pretty much over the years rotted away, and I've broken off as I used one. It broke off, and the decay is pretty much... I've been to a couple of dentists, and they've recommended essentially that all of my teeth be removed, and I get plates. Mm-hmm. I've got about 3 or 4 teeth that for some reason seem to have resisted decays, but one concern I have is everybody mentions the use of a lot of antibiotics, and I've taken very good care of my nutrition in my system and have never had any sicknesses, and I'm concerned that the antibiotics will essentially kill the beneficial bacteria in my body, and I don't know what...
Okay. Well, from what I hear, I think you don't need to be on antibiotics unless you have a reason to, unless you have an active infection. And actually, for a limited time only, maybe 7 to 10 days at the most. Longer than that means that the source of the infection or the abscess or the tooth causing the abscess is still there, and that, just taking some antibiotics does not heal it or does not take care of it. So the actual treatment has to be done, which is extraction of the tooth, and then the body is given the chance to heal. Prolonged use of antibiotics is not recommended. As for your case, like I said, that would be the perfect case we would treat. You would come in, we would give you a consult, we will take out the few teeth that are left if we need to, or plan to keep them and add to them implants with teeth attached to the implants in the same day, and you get to function the next day.
All right, let's move on. Let's go to Florida in Humble. Hi, Florida. What's your question for Dr. Hanna?
Hi, good morning.
Good morning.
Good morning.
I have missing teeth, and the dentists have told me that I have bone loss. And
yes.
Can I get implants?
Yes. Well, actually, it is very common to have bone loss after you lose your teeth, because that's how the body heals, by shrinking the jaw, and because the teeth are no longer there and there's nothing to keep the bone in place. But the good news is, even with the most severe bone loss, we still can place implants and do what is called bone replacement grafting, which is artificial bone that is placed around the implant, and your own bone will grow and replace this to have a healthy jawbone again.
Okay. Thank you.
Mm-hmm.
Thank you, Florida. Let's take another call from Liz in Houston. She's the longest in the queue. Liz, what's up?
Actually, the lady before... Oh, good morning.
Good morning.
The lady just before me asked my question. I had gone years ago, about 10 years ago, to check out the implants, and they said that I didn't have enough bone.
Yes.
And they were going to have to put in some kind of plate, and I didn't want that.
I would encourage you to come and get a second opinion, because first at Dentiq we have, for example, on-site a 3D scan machine. So that will give us more chances to show what exactly or how much bone you have, how much graft you need, if any. And also the surgical experience and the surgical techniques have evolved, and we can place implants even with the least bone available.
And that's all the time we have today. Thank you, Liz, for your call. We appreciate it. Thank you to all of our callers for today, and especially thank you to Dr. Raouf Hanna. He is, again, as we say, Clinical Associate Professor at the University of Texas School for Dentistry, Department of Periodontology, and a practicing physician at Dentiq Dentistry at Houston. We always advise you to get real professional help, but this is supposed to be something to lead you on your way. Thank you for joining us. I'm Marlo Blue. Have a great day.